Well, also tonight, to the fight for funding. With many organizations losing access to critical federal dollars under the Trump administration, there is a push to find new lifelines to help keep their vital work going. Jewish Family Services has been greatly impacted over the past few years when it comes to funding. Since 1862, the nonprofit has provided members of our community with critical health and human services, regardless of their religion, ethnicity, cultural background, gender identification, ability, or age. It is a mission, though, that's becoming more and more difficult to fulfill when you talk about that funding fight. Dr. Molly Carr is CEO of Jewish Family Services and joins us live here tonight. It's great to see you.
It's great to see you. Thank you for having me.
Absolutely. So walk us through some of the funding challenges that are impacting Jewish Family Services right now.
Jewish Family Services has a very broad array of services that we provide to the larger Western New York community. Currently, we have Medicaid-funded programs and we have other federally funded mental health services that support Western New Yorkers across a broad spectrum of needs. And right now, we're waiting to see what happens with those as we hear conversations about possibly cutting Medicaid or other programming. But the big challenge that's really facing us is we are also one of the 4 refugee resettlement agencies here in Western New York. And so you're probably aware, refugees are brought to the United States through a program with the State Department, and we're contracted to provide core services for the first 90 days. And we learned on January 24th that the federal government was not going to pay us for those services. And those are things like direct assistance, like covering the cost of rent, buying food for individuals, and helping them get ready to start work here in the United States so they can become self-sufficient. And that's created a critical hole in our budget, which is significantly impacting our ability to provide services across a broader spectrum as we have to make sure that individuals don't become homeless.
And to be clear, we're talking here about refugees who, as you mentioned, have gone through this process with the State Department, in many cases a years-long process. This is a separate issue from kind of the migrant crisis at the southern border, right?
Absolutely. The United States has received refugees here since the 1980 Refugee Act was passed, which I should say was passed almost unanimously by Congress. Refugees are brought to the U.S. after almost a 3-year vetting period. There are multiple security agencies that review their processing, and they've proven that if they return to their home country, they could be killed or persecuted because of their religion or their ethnicity. So when they are brought here, they understand that they are to become contributing members of our community, that they're going to be expected to work and to learn English. And they sign on to that agreement, understanding that for the first 90 days, we'll be there to help guide them through their process and cover their expenses. So
I mentioned earlier, part of this is kind of taking the funding fight to Albany, as you obviously also lobbied lawmakers in Washington, D.C. to come through with that money. We're in the middle of budget negotiations at the state capitol right now. How active are you out there saying, look, we need this money?
Yeah, we are very busy right now. We are meeting with our representatives. It's really important for us to make sure that we can have longevity of services to support the refugee community here in Western New York. Not only does the support help refugees, it also helps local employers. We have people who get jobs in healthcare, who get jobs in home care. These are the community supports that we really need to build up capacity to staff, and refugees often fill those positions. Right now we are talking with our state legislators about increasing funding to the New York State Enhanced Services for Refugee program. We're asking for the funding to be $15 million this year, and that small amount of funding will allow 10 agencies across New York State to provide critical services and keep people employed.
And you have your big fundraiser coming up in just a couple of weeks. I'm almost out of time, but people can still buy tickets to go to that, right?
Absolutely. The Matzo Ball, March 6th. Go to our website to purchase tickets. It's going to be a great time. Theme is Kaleidoscope, so everybody come with their colors.
Our Michael Schwartz is going to be there. He's super excited talking to us about
yes.
it. Yeah. Dr. Molly Carr, CEO of Jewish Family Services. Best of luck as you work through all this. We appreciate you coming in.
Thank you very much.